Today, we're particularly concerned that 3 out of 4 Americans don't take their medications as directed. A complex problem like medication adherence really has to be addressed on several fronts. First with the patient, then with healthcare professionals, and as a whole, the healthcare system. The League's focus, though, with this campaign is on the patient. Poor medication adherence can lead to illness, can lead to extended hospital stays, and can even lead to death. Many avoidable health care costs are associated with poor medication adherence. We're focused in this campaign on 3 chronic conditions: diabetes, cardiovascular disease, and respiratory disease. Why are we focused on these 3 conditions? Because people with these conditions, for people taking medications for these conditions, not adhering can have very serious and very costly consequences. So Script Your Future will promote, hopefully, this is the goal of the campaign, will promote conversations between patients and their caregivers, between patients and healthcare professionals about taking medication as directed and how that can help them manage their condition.
Prevention is the foundation and the goal of our public health system. And in a time that we are all expressing concerns about the rising cost of health care, prevention will be a key to keeping that cost in line. And prevention means taking prescribed medications on time and as directed. Each and every one of us grew up hearing that old adage, an apple a day will keep the doctor away. Well, taking your prescriptions as prescribed will keep the hospital away. Taking your prescriptions as prescribed will keep blindness away. Taking your prescriptions as prescribed will prevent heart failure. Taking your prescriptions as prescribed will reduce the cost of health care.
Another way to put this and frame this perspective is that money. How much does this cost us? So the estimates right now for non-adherence right now, $100 billion to $300 billion are directly affiliated with non-adherence. So if we are in a situation where we have to think about healthcare costs, there is no better place to really focus our energy and think about how we can improve non-adherence.
As healthcare practitioners, we easily forget that obtaining a prescription and initiating a medication regimen involves an interruption in the patient's everyday priorities of life. Behavior change must occur for the patient to develop long-term compliance with their drug therapy. The patient-practitioner relationship can enhance the patient success with necessary behavior change to go forward. We have a difficult economy and have for a number of years now, and cost does come into play, and people modify their medication regimen on their own to their own detriment at times. They also stop taking their medication due to side effects, social issues. I've had patients that are more concerned about their social drinking than they are taking their medication, and the two don't mesh together, so they choose their drinking.
Patients with chronic health conditions need to get serious about their prescribed medications to enable their healing system to get the push needed to feel better and get well. Patients should always carry a medication card showing meds and time to take them as prescribed. I keep a little business card with my meds on there typed up in my pocket all the time. That 6 o'clock pill always comes into being at the wrong time. It comes, you could be standing in line at the cafeteria, oops, 6 o'clock. You got 40 people ahead of you and 100 back of you. You got to take that pill. People are not as conscientious about that as they should be, and they need to really get serious about it.